Hello and welcome to the Pre-Chiro podcast. I'm your host, Dr. Ben Glass, and today we're making a professional chiropractor connection out in Montana with Dr. John Wilhelm. Dr. John, can you get us started by just sharing a little bit about that pre-Chiro story, that moment in life where you decided you wanted to become a chiropractor and what it was that attracted you to this path?
Sure. Thanks for having me, Dr. Ben. Yeah, absolutely. That's an easy one for me. I grew up as a next door neighbor to a chiropractor, and I had hurt myself playing basketball at age 15. I jumped up and grabbed the rim, and at that point jammed my sacroiliac joint. But all I knew was that my low back hurt, and I couldn't get it to not hurt. I remember being in the back of the bus traveling to games and rubbing icy hot on it, and tried some physical therapy. And anyway, couldn't get relief. And I was the kind of young man who shot baskets every day out in my driveway. And when my neighbor drove by a few times, he saw me not out there, or noticed I wasn't out there, and actually caught me as I was taking the trash out. And he said, "What's going on, John? I don't see you shooting baskets." I was like, "Man, my back hurts." He says, "Well, I'm a chiropractor. I can help you with that." And I had never even made that association, even though he was a great neighbor, a good friend of the family. Anyway, fast forward 2 visits later, I was moving and feeling better, and that kind of put chiropractic in the back of my mind. And then when I went to undergrad, I was still kind of undecided in research careers, and chiropractor, attorney, and engineer were the three that I chose to research. And the more I looked into chiropractic, the more I was excited about it. Shadowed a few chiropractors, and the rest, they say, is history. I started my schooling at Life University in year 2000. And yeah, that's my chiropractic story. Just happened to have a great chiropractor as a next door neighbor, and had a positive experience as an athlete myself.
And if you could just speak to a high school athlete while we're on the topic and unpack this path, this profession, the specific pathway that you've taken and the experiences you've been able to enjoy as a chiropractor, how would you really bring a student into the fold or introduce them if you were their guidance counselor in this moment?
Yeah, that's a really great question. And actually, we've done just that. In fact, there's a student right now at Logan College, and she was a high school athlete that was a patient of ours, and then turned into a great employee, and then now is in her last year as a chiropractic student. And I always tell them it's a great career. You get to use your hands, you get to help people, you get to serve people. You can make a good living at it, and it's just, you make a difference in people's lives every day. And it's easier to show them what you do than to tell them. And so what's nice is we still volunteer at local high schools and spend our time helping athletes achieve. So if I was to unpack it for them, I would tell them how it's changed my life, and been great for my family, and we've really impacted the community in a positive way. And you really get to help and serve people.
You keep mentioning that you've been able to help athletes, or that you were an athlete and a chiropractor worked with you. How do chiropractors work with athletes, if you were to give a broad overview on chiropractic for athletic performance, or for recovery, or just for optimizing whatever an athlete is focused on?
Right. Well, I can share my personal journey, and that's that obviously I was an athlete when I first was exposed to chiropractic. But then when I was a chiropractor, I wanted to pay that forward. So coming out of school, I hung out my shingle, started my own clinic, Pro Chiropractic, in Bozeman, Montana. Actually, we were in Belgrade, right outside of Bozeman. And I liked working with athletes, and I liked learning new things. And so I just kind of started working with everybody that I could, and athletes were one of those demographics. At that point, I wasn't a certified sports chiropractor. I didn't know the intricacies of it. I just knew I liked working with an athletic population. And I think that's what a lot of chiropractors do, especially at first. They just get out there and they serve, moms and dads and working people, and kids and babies, and athletes are part of who they serve. But the more I got into it, the more I realized that you could really specialize working with athletes. In fact, I was working, or actually, I was attending a continuing education seminar. The old Kinesio Tex Gold, back when Kinesio tape was kind of a new thing, before Rock Tape and some of these other brands hit the market. And but I loved going to these weekend seminars and learning things that I could use that coming Monday. Anyway, the teacher of that seminar gets up and, like most instructors do, he gives a little of his background and his clinical acumen. And he says, I've worked with the Paralympic team and I was at the Pan Am Games. And there I am, this young, new clinician living in Bozeman, Montana. And I heard this and something just kind of piqued in my mind. I said, wow, I didn't really even know at that point that chiropractors could take that path and could work with Olympic athletes. So that kind of resonated with me. And on a break, Ben, I myself and a couple other students kind of cornered this instructor, as sometimes happens, and I said, "Tell me more about this." And he laid out the path of what it means and what it entails to be a certified sports chiropractor. Kind of laid out the path of education, what kind of things that elite sport teams look for in the way of additional training and modalities and expertise, and that really set me on a path of doing that. And so we can get into some of those specifics if you want, but that was my personal journey with it.
Yeah, I would love it if you continue talking about your personal journey of after having learned from this chiropractor or from this teacher, the specifics of how you would go about doing different trainings, getting different exposures, gaining different experience. If you could walk us through what you did after that and maybe how you either listened to this person or took your own path. Yeah, go into detail if you can, because we're trying to really uncover as much as we can for the prospective student, but also the current student to understand what they should be looking at and thinking about for themselves.
You bet. Well, for me, I found out that I was sort of already on that path by being interested in learning new treatment techniques and modalities and diagnostic approaches. So I had already certified with Graston technique, for instance, and taken the CCEP, the Certified Chiropractic Extremities Practitioner course, and a couple other things. And so when he was naming off some of the things that that athletes look for, they look for extra training in movement analysis, in soft tissue work, in taping, in emergent sideline care. These are some of the things, in addition to a great foundation of being a great chiropractor to start with, being able to adjust the spine, to adjust the extremities, to being able to properly assess and provide an appropriate diagnosis as part of a medical team. And so these were some of the things that I was already doing. But then I found out that you could also be a certified sports chiropractor. So a CCSP in the United States, Certified Chiropractic Sports Physician or Practitioner, depending on the state and how they let you define yourself, whether you can call yourself a physician or not. So I set about that path, and that was 7 modules over about 2 years and a written examination. That particular designation is overseen by the American Chiropractic Board of Sports Physicians, and they have 2 levels of certification. That's the first one, the CCSP, and then they have a diplomate in sports, the DACBSP. So I know we get into some alphabet soup now, but just know that in the US, there's 2 sports-specific certifications that are recognized that somebody can take if they want to further get a basis in education in sports. And there was a lot of things that I was exposed to that I wouldn't have been otherwise in that course. So I think it was very valuable. Basics behind, understanding temperature type injuries. What's the difference between heat stroke and heat exhaustion? What are the most important parts of a PPE, a pre-participation examination for an athlete? What kind of questions do you want to ask on the cardiac exam? All important when you're dealing with athletes and athletic individuals, especially youth athletes. And so these are some of the things that I got a solid background in while continuing to hone my skills in hands-on training. I was taking taping seminars and rehab seminars and a bunch of different approaches just to hone my skills. And I want students to understand that this doesn't happen overnight. And for me, it really didn't start happening until I was about 5, 6, 7 years into practice. And I think something that happens to students is they get this feeling of FOMO, the fear that they're missing out, and if they don't do everything while they're in school. Look, if you're directed and you're a goal setter and you can knock some of these things out in school, great. It gives you a better foundation, and you're probably ahead of where I was. But it also advantages you to have a great foundation as a chiropractor, treating all types of people before you try to go on and then specialize. I find some students try to specialize before they ever have a foundation, and they kind of get the cart before the horse. Ben, so that certification turned into more involvement working in my local community. As I had more skills to serve athletes, we volunteered more in the community. We were sideline at mountain runs and races, at triathlons. I started working more full time with a high school team. I was their Tuesday guy that came in the training room, and then I was sideline at this small high school in Montana as their at every varsity game: volleyball, basketball, football, track and field. And so that's really where I cut my teeth, learning to communicate with athletes, communicate with coaching staff, to work with administration, to provide great care, to protect the athletes, and to treat them and help them to perform. One thing that you'll see in my social media is the hashtag, and actually now we've trademarked it, helping athletes achieve. I think that really coins the phrase of what we try to do. And so as the journey continued, Ben, I got more and more involved. I got involved with the ACBSP and was on their board for 6 years. Again, this is the organization that certifies the exam that you can take to be a certified sports chiropractor in the U.S. I also got involved with the ACA Sports Council. The ACA Sports Council is the national body that's for promoting sports chiropractic. They provide opportunities in education and also networking and involvement in games in the United States. And that opened my eyes to international sports chiropractic. And so you start meeting more people and talking about it. They said, well, you can be part of the World Games or the World Sport Games, or work with teams and things overseas. You just have to also get your international certification. And so FIX, which is the International Sports Chiropractic Federation, I learned about them and learned about their certification and took the training for that, and starting it involved internationally as well. So there were a couple lanes going at the same time. I was building my base of education. I was building my networking by getting involved and naturally wanting to meet the movers and shakers and people who were involved, and I was getting involved in the organizations. And then I was just broadening that across, and that turned into some other really cool opportunities that we can talk about, but I want to make sure I give you a chance to ask your questions.
Yeah, no, definitely. And I really appreciate you going into detail about the different opportunities that are out there if people want to take this path. And you're speaking from experience. You're not speaking from this theoretical, which helps so much more. And I think that's the true value of these conversations, is the people that I'm interviewing are speaking from experience of what they did. It's just giving exposures. If people want to go have experiences, they can on their own terms. And it's ultimately their choice what they decide to do with their path. We're not pushing any particular direction on them. So I really appreciate you going into detail, because I think that it just simplifies the process. Is there any simple, I guess, if you were to tell a student, these are the 3 or 4 things that I would focus on to build my foundation? Because you mentioned the importance of building a strong foundation before you go and specialize. So maybe if we could create like a simple structure to direct and orient students that are wanting to practice certain skills or wanting to develop their awareness and their thinking, if you could maybe give that a shot, and then we can move into other subject matters.
Sure, you bet. And Ben, I actually have already done this. I have a PowerPoint presentation. Actually, I came to Life West and spoke with the students a couple months back. And one of the slides is the Great Pyramid in Egypt. And what I have is as a foundational block at the very bottom of the pyramid of this structure is be a chiropractor first. Listen, when you get into sports chiropractic, especially, and learn some other modalities that advantage athletes, there is soft tissue treatment. extra spinal adjustments, taping, rehabilitation, movement analysis, emergency procedures and protocols. There's a lot of tools, and you can look like a physical therapist or an athletic trainer. And there is some overlap in expertise, which makes you more valuable to that athlete and that team if you can provide those things. But what I always say is be a chiropractor first, because you'll be able to offer something that no other practitioner or professional offers. And that makes you unique. And there's certain times that that's the only thing that they want you to do. And that's just fine. You come in to do that at an expert level because everything else is covered. And there's other times where you're expected to triage injury, to provide rehabilitative advice, to do soft tissue treatment or dry needling or whatever other modality that they need for performance or recovery or injury rehabilitation. So that to me is really important, having that foundational base where, look, you can analyze and adjust anything 3 different ways. Do that before, get really good at that before you start stacking those blocks. And on the next level, I have learn a soft tissue skill that resonates with you. I'll throw out some names, but there's Graston technique, right? And there's factor analysis, and there's dry needling therapy or fascial manipulation or active release technique, or there's all sorts of different ones, and different students and different schools are exposed to these, and some are not exposed very much to any of them. But I think if you're wanting to be a sports chiro, you're going to need a soft tissue approach. Now, again, what I find is some students try a shotgun approach. They're exposed to 7 different ones, and then when they're asked to do one, they're kind of a master of none, and they don't really know what to do. So I say grab onto one, like kind of dip your toe in, see which one resonates with you, and then really work on that one for the first few years. That'll serve you better than knowing almost nothing about 7. Okay, so that's one of the next blocks. And then performance taping is really important. Now, I kind of have that under an umbrella because there's rigid taping, kinesiology taping, dynamic tape, and so there's probably 5 or 6 different types of taping modalities that I use. These are important with athletic type of patients, and having an understanding or a mastery of at least one of those approaches is really going to advantage you. You don't know how many times I've been asked, Dr. John, can you quick do this wrist? My thumb needs to be taped. Can you tape my ankle? What can you do how do you wrap a quad, or how do you tape a low back? And if I didn't know how to do those and just said, well, I'm a chiropractor, I don't do that, then I would offer less value to that team. Now, I'm not saying do something you don't have expertise in, because that'll also backfire worse. Make sure that you understand what you're doing before you offer it to that athlete and to their performance. But if you can offer the greatest adjustment together with great soft tissue work, great stabilization advice, tape them for their event so that they can perform pain-free, boy, you're really valuable to that athlete and that team. And so we're building that foundation, be a chiropractor first, add a soft tissue treatment that you resonate with, and a taping treatment. And then in my lecture, I talk about some of the other things that are important. And then I actually have a list of what I think is vital to work with elite athletes, and then also a list of what I recommend to work with elite athletes. But that's the start of it, and you have to come to my lecture to learn more. No, I'm just teasing. But honestly,
No, you really did an excellent job of giving a general overview, and like you said, if they want to learn more, there's opportunities. We're building an information network, so we can work together to make it easier for students to access things that you talk about at a deeper level if they want. What can you talk about the culture that you're observing within the student body, but also within the profession's body of pro chiropractors that are really interested in this field of study, or maybe working with teams? There's different organizations, I believe, for the NFL or maybe the NBA, different professional sports. What can you talk about the culture of chiropractic in sports in today's world and society?
Okay. Well, first thing that comes to mind is that sports chiropractors are outliers. Okay. We spend a lot of time in continuing education honing those skills. So then we can take all of that time and money we've invested and then go volunteer for a team and spend more time and money helping an athlete. So I'd say that's one thing, is that it's often, especially at the start, you cut your teeth and you pay your dues volunteering. So if somebody's looking to get rich and famous real quick through being a sports chiro, boy, that doesn't happen very often. Now, having said that, because over the last several decades we've proved our worth to teams, there are more opportunities. There are more opportunities today than when I started 18 years ago in practice. And there's definitely more opportunities because we stand on the backs of great people before us that broke down walls and doors so we could even be in with these teams. So I'm very grateful for that. And I take it as a great responsibility to pay that forward and open up doors for more students and young chiropractors coming in. So first thing is, it's based on volunteerism and love for sport and for the athletes and to help them achieve. But there are more opportunities with professional sport, with Olympic sport, and paid opportunities. Now, almost everything that I do, with a few small exceptions, is paid, and I get remunerated for my work. And that's a nice feeling after you've invested so much time, to be recognized that way. But again, I'd probably make more money in my clinic than I do, traveling with Olympic teams, right? But the culture is also very family oriented. There's only so many certified sports chiropractors internationally or in the United States. And so you rub elbows with the same people a lot. And we're all on a similar path. Just yesterday, I was having a phone conversation with a good friend of mine in Minnesota, Dr. Scott Mooring, and he's the sports chiropractor for the University of Minnesota. And we've done a lot of international work and events together. And it's just great because we're on a similar wavelength and mindset, kind of like just chiropractors are in general, but take that to the next level, right? Because you have a deeper understanding of what you're doing, and it's easy to get in an hour, 2 or 3 hour long conversation. So the culture is really neat because it's like a tight knit family, but then it's growing. I see all these opportunities, and you mentioned with professional sport, there's a professional baseball chiropractic society, professional football chiropractic society. I believe the same for hockey. There's obviously a lot of work, excuse me, around the Olympic movement. So you can get involved with Team USA. I just got back from 7 weeks traveling with Team Australia, and working with them in Europe for winter sport. And yeah, there's so many opportunities that are out there, and I'm excited about that for students who are coming up the chain. So the culture is really a positive one. You do have to work to distinguish yourself, but there's a lot of people to help you up along the way, which I'm really proud of our profession for.
Can you maybe just give some insight or shine a light on the complexities of working with a professional team, the Olympic team versus a high school team, some different considerations, maybe just awarenesses that you have to have, or levels of experience that you have to reach in order to be more qualified for certain, how did you land that Olympic opportunity? Is it relationships that you've built? Is it certifications? I'm just curious. If this is off topic, we can move to something else.
No, it's not off topic at all. There's a couple of questions weaved in there. So I'll just kind of tell you about my particular experience, because there are several roads into it. But I think I had a very kind of traditional one. So after I had certified as a sports chiropractor, and going back to that discussion I had with that doctor at the kinesiotaping seminar, he said, well, you should go do your 2-week internship at the Olympic Training Center. I said, my what? He goes, yeah, you can go volunteer and do 2 weeks at the Olympic Training Center once you're a sports chiropractor and you have some of this background and you've worked with the team. Well, anyway, there are still opportunities for sports chiropractors. You have to be a certified sports chiropractor. You have to get letters of recommendation and background checks. You have to have worked with a team, I believe, for at least 3 years. It can be a local youth football team if you want, but then you just get recommendations from coaches or athletic directors or whoever it may be. And then you're accepted in to do a 2-week rotation. At that time, it was in Chula Vista, California, Lake Placid, New York, or Colorado Springs at the main training center. I did mine in Colorado Springs. And while I was there, I worked with all sorts of different athletes. I literally, Ben, thought that was going to be my Olympic experience. I'm just a small town guy from Bozeman, Montana, and I thought, boy, that'll be it, you know. So I was remember being at the lunch counter and in the cafeteria and just like, oh, there's a triathlete, and there's a swimmer, and I think those are weightlifters, and you know, it was just really cool to be exposed. And then you're rotating with volunteers from other professions. So at the time I was there were orthopedic surgeon, physical therapists, athletic trainers, massage therapists. Those are the disciplines besides chiropractic specialties that get invited to do that. And so we would all talk about it and all share ideas. And you're co-managing similar athletes with injuries or issues or helping them with performance. And I got done with that, came back to Montana, and thought that was it. Took a bunch of pictures while I was there, and that was fun. And then I actually got a Twitter message from an athlete, and he's allowed me to use his name. And so I tell this story quite a bit, but Kurt Tomasevich is his name. He was a bobsledder. Well, before that, he was a football player for the University of Nebraska and did really good there, and then found bobsled. And in 2010, he won gold for the first time in 56 years with USA bobsled skeleton at the Vancouver Winter Olympics. And so when I had met him, it was 2013 in the fall, and it was leading up to the Olympics in Sochi, Russia. And so they were, you know, priming for their Olympic season. Well, he sent me this Twitter message and said, "Hey, John, I talked with a bunch of the other athletes, and we really enjoyed your treatment. We liked what you did, and we think you have what it takes to come with us. Would you come on World Cup tour with us?" I about dropped my phone, of course, and said, "Yeah, what do I need to know? I mean, I don't really know bobsled." He says, "Don't worry, I'll take care of all of that." And he sent a recommendation, and copied everybody on an email I got about a week later to the head of sport and the head of medical. And fast forward a couple months, and I was in Calgary, Canada, and then Park City, Utah for World Cup. And that turned into those 2 weeks. And then my first international trip to Germany the next year, and then more weeks and more involvement until my first Olympic Games in Pyeongchang, South Korea with USA Bobsled Skeleton and Team USA. So that was my path going into that. And so you asked, does it take training, education, or relationships? All of those things. I always tell students now that the education and training you get in that foundation you're getting with your patients opens the first few doors. And then the relationships that you have, okay, open the remainder of the doors. Because you get to a certain point where everybody is really skilled. And then it's nuances in personality and things like that open up the doors. You know, work ethic and you know, being somebody easy to travel with, being a hard worker. Some of those intangibles, right, open the door after that. So the answer is both of those things, or all of those components, are important, and all of them helped me in a certain way. And sometimes the timing is just right. I feel like you know, you make your luck a little bit, but then sometimes you're lucky as well around who you're around and how you perform. But I think a lot of that is based on hard work and training before you get to that moment as well.
Amazing. So now that there's momentum within the field and we're standing on the shoulders of giants that came before us and really leveraging these opportunities that they created, but we're leveraging them in a sense that there's more of them available. There's probably more structure and organization. Which organizations are you most involved with today that you care about the most based on your involvement and your energy that you're putting towards them? And maybe talk about some projects that you're working on, or some of the brewings of what's bubbling up in the present moment and is going to continue to be available for people as time goes on.
Mm-hmm. Well, that's a hard one because I'm really proud of a number of different organizations. I suppose myself, if I look what I've thrown my energy with over the last couple of years, that would be with FIX, with the International Sports Chiropractic Federation. I think they're doing some tremendous work. They've revamped their educational program to test and certify and to train sports chiropractors internationally. One of my good friends, Christine Foss, was integral in the education chair in doing that. They're deeply involved with a number of international federations, everything from kickboxing tug of war, to powerlifting, to other sports, and they're providing opportunities for sports chiropractors to go and serve in a number of different countries. I looked at the list coming up, and there's events in Dubai and events in the Netherlands and in Paris and in Thailand and all over the world, right? Which is really a cool thing. So I would say at topmost that I'm involved with currently would be Fix. I'm part of their education committee. I'm one of the instructors for the modules that they give. I'm also the chair of the student commission, and our mission is to educate students about the opportunities in international sports chiropractic. So I'm really proud of the work and the family, the international family that I've found and built. I can now go to just about any country in the world, and I have a chiropractic friend there, and that's kind of a neat feeling. It really, really is. And I don't want to leave behind, my good American friends and what I started with. I have a lot of friends at the ACA Sports Council. They're doing a great job in the United States about mining opportunities and creating camaraderie within the United States in the sports chiropractic community. And the ACBSP still does a wonderful job of preparing sports chiropractors with the American certifications, the CCSP and the DACBSP. So those are the three that I'm involved with the most. Fix, I'm giving the most effort to right now. And then I do some work on my own with elite international athletes, not particularly promoting any federation or any organization, just trying to serve athletes. So I've worked with Estonian speed skaters, Austrian mogul skiers, Lithuanian high jumper, Greek pole vaulter. Now with Team Australia, and in the last Olympics, I was under a British credential in Beijing just last year. So once you open the floodgates and have a reputation and do a good job serving those athletes, really the opportunities are endless. So for me, the sky's the limit, and I really am excited that for those coming behind me, there's even more opportunities if we are good stewards of the opportunities presented to us.
Oftentimes in practice, you can gather testimonials if you want. You can share stories now online through social media. What are some outcome measures that you track when you're a sports chiropractor working with a high-level athlete or a team where you're able to, at the end of the season or at the end of the event, put together a one-pager or put together some sort of reflection on the work that you did and the outcomes that you were able to achieve? Can you maybe just give some examples of different cases that you're met with in different unique situations? Because you just talked about the variety and the diversity of scenarios that you might end up in based on the different sport or the different athlete or the different event, their age, their psychology, their body type, their injury. Can you maybe just talk about how being a chiropractor allows you to think more holistically and some of the outcomes that you've been able to achieve, or maybe just some of the experiences that you are directly working with when you're working with athletes?
Sure. That's a really deep question, man. It's a good one. Listen, one of the metrics I use, and this may be very basic, is do they want you back? If you spend 10 days at a training camp with these athletes, they'll know pretty quick if you know what you're doing and if you help them achieve, right? And so that's one of my metrics is, have I built a good enough relation and shown enough value to them individually as an athlete, to their team, to the coach, to the federation, whatever that may be, that they'd want you to come back. So that's a metric I use is repeatability and longevity. And also trust is a metric that you use. Do they trust you with their performance? And you'll notice that if you work with a team, some athletes jump right in and get right on your table. Some stand at the side and say, I'll let Joe go first, right? And then see how it works. And that's one metric is athletes pretty quickly know whether you do a good job, and they'll share. This was an experience I had at the Olympic Training Center, is that, the first day or two is kind of slow and a few athletes trickle in. And if you do a good job, you're really cranking and busy by the end. So that's a metric that I like to use as well. I'm very proud of the fact that most of this I've done without any marketing, right? I'm not out there, really marketing to different federations and things like that. It's word of mouth, just like it is in your practice. One athlete likes what you do, or their coach or their agent or their strength coach or whatever it may be tells another type of athlete, maybe in a totally different sport, hey, you need sports chiropractic to help you out as well, and then your name is shared there. So if we dove into actual seasons, for instance, I helped Team Australia with this second half of the bobsleigh season internationally. Like I said, I just got back from 7 weeks. It was really important for me as a metric to make sure that I understood when the athletes were peaking, because they have World Cups each week, but then a World Championships. Okay, so they have to perform on every Saturday and Sunday, rest and travel on Monday, train through the week, and then perform again, but then somehow periodize their workouts and their performance so they have their best performance at World Championships and aren't broken for that. And so there's a number of things that you do throughout each day, throughout a week, and in that whole plan to make sure that that athlete is performing their best at World Championships. And I was very proud. This week, I came in and was managing a hamstring injury on one of my pilots that she had presented with before I arrived in Europe, together with a couple other complaints that she had and some of my other athletes had, and to be able to help them in performance. Not have to just pull them out, because you can't all the time, right? Just rest for 2 weeks, right? That doesn't happen on the road in a World Cup season, right? If there's a time where the athlete needs to be protected, you have to make that call as a sports chiropractor, right? But normally you're managing to that. And then the fact that she was able to push her best and perform her best at World Championships, I was really proud of. And we were able to finish the season on a high. And actually, I'm really proud of the fact that 2 Olympic athletes, one German and one Australian, are actually arriving tonight in Montana to get about 10 days of therapy here. So they've traveled all across the world to come and get some work here, and then they're going to go up to Canada, where one of the coaches is. But that is a pretty neat metric too. They could get all the physio that they want or have access to athletic therapists or trainers there, but they've chosen to come and rehabilitate and work on some things here, and prep for the summer season. So that's pretty cool too. So I hope I've answered your question. I bounced around a little, but it was a pretty deep question.
It's a challenging question. I think that oftentimes teasing out the details can be a bit esoteric. I'm basically opening a window and I'm saying, can you talk about what you see outside, and how you interpret that is up to you. I appreciate you just sharing any insights you can. At the end of the day, I'm just a curious student who's trying to expose other curious students to that which is out there. There's so much out there. There's so much nuance. There's so many little tiny details that if somebody heard one of the 100 things you've shared so far, that might be the light bulb moment that they need to go and take the next step, right? It's all about these next steps. Can you talk about maybe some things that are going on in your mind that you see are needed to support students more so in chiropractic schools today, to really, if they do have this genuine interest and they hear you speak at a talk at a sports chiropractic club, how are you maybe giving them marching orders to, hey, I know that it's difficult to go travel to seminars, or I know you don't really have a ton of time, but maybe just any words of advice you could use to support a chiropractic student who's interested in sports, speaking directly to them right now?
Mm-hmm. Yeah, get involved first. If you have a sports chiropractic club on campus, which most of the schools do, get involved. That's the first and easiest way. And don't just stop there. Get involved in technique clubs, get involved in movement analysis clubs, get involved in everything you can while you're a student. That's when you're soaked in this academia, and that's when you get inspiration, is being exposed to these things. And then at a certain time, it'll kind of crystallize and solidify. Not that you have to have a 10-year plan, everything written down, although I'm that kind of guy. I write down my goals. But when I look back, just the fact that I wrote down a goal sent me in a direction. And sometimes that road shifted just a little bit. So get involved, first of all. And look, if you don't have those things, you can start them. Okay. You can, get in touch with somebody who is part of a student commission, and our goal is to help empower you to do that, help give you resources. So if you just, well, we don't have a sports chiropractic club, so I guess I can't be a sports chiro. If you fold to that, then you'll never make it as a sports chiro. But if you're the kind of one that says, well, I want to learn more about extremities and treating athletes and what these athletes need and do, and what sports chiropractors are doing, what opportunities, boy, if you're excited, it's not going to be very hard to find some people that'll help you and lift you up and get you plugged in to those kind of things. I've found that the best mentors, and there's a lot of them, are freely give of their time. And so if you run into somebody that doesn't, don't let that stop you. The next one is probably going to really help you because, like I said, it's very much a family. And so, number one, get involved. Get out there. Look, I know you're busy. I'm busy too, right? And I remember as a student, I thought I was so busy. You have neuroanatomy class, and you have diagnosis class, and palpation class, and this technique class, and you're so busy. And but guess what? There's always time for your passion. And when you align that work with the passion, that's when it really gets fun. That's when it starts making sense. You start putting these things together. And what's really cool is that there are opportunities out there for students. For instance, Fix includes students in the games teams that they pick. We had 4 students with us at the World Games last year in Birmingham, Alabama. And just so you know, the World Games is the Summer Olympic Games for all the sports that are looking for inclusion in the Summer Olympics. It happens every 4 years. And Fix, the International Sports Chiropractic Federation, has contracts to bring sports chiropractors to every World Games into the foreseeable future. And students are part of that. Now, because they're not licensed yet, they don't get to treat, but they get to glean information. They get to rub elbows with practicing sports chiros from all over the world, right? They get to, we would take them to the side and say, okay, what do you want to learn? Okay, show me how you work up an ankle, or show me what you do with this injury, or how do you communicate about that? It's really a cool experience. And so getting involved opens up those opportunities. Find out what the ACA Sports Council does, when their symposium is. If you really want to be involved with professional football, join that society. Get with those people and rub some elbows with practicing football sports chiros. You know what I mean? If you love baseball, do that. Get around those people that are in that. And that's how naturally relationships form. Education is shared and opportunities present.
You know, you're an amazing communicator, and having the foundation at Life University, you've obviously been exposed to the chiropractic philosophy, and I'm sure it shaped a lot of how you practice, at least early on. Can you talk about what it's like to be a sports chiropractor that ends up in a situation where you really do have to communicate value of what chiropractic is and why you being a chiropractor is unique, that you are not the athletic trainer, that you're not the physical therapist? Because having been in certain scenarios where I was the team chiropractor, or the team sports doctor, they called me, I found myself continually having to remind people of what chiropractic was. How do you introduce athletes to chiropractic? How do you sort of bring them into your world a little bit, into your way of thinking about how you look at a human body? And if you could just maybe touch on that. I know it's a side tangent, and it's just giving us some insight into the experience.
Sure. Yeah, I'm happy to address that. First of all, I found that, there's kind of 2 different parts to that question. One is being part of a greater medical team, let's say, right? Because often you're there and there's a managing medical doctor, right? He's the medical director, and there's a couple physical therapists or athletic trainers that are part of your team, and usually there's one, maybe 2 sports chiros if you're on a really big team, but usually you're kind of the cheese that stands alone representing sports chiropractic, right? What I found is that actually it's less adversarial than you might think working when you get to a high level. In fact, there's a lot of curiosity around what chiropractors do, what we can offer. And most of that stuff is not, like I said, not adversarial or attacking. It's more just they have interest. They don't really know what our educational background is. They may have just a rudimentary understanding. They may think that we just crack things and that's it. Right. But that's where there's opportunity to let them know, that we look at an athlete wholly, that we're trying to affect their musculoskeletal system, their nervous system, their ability to recover, their ability to perform. And especially if you have a number of different tools, they go, wow, you can do that too? Well, hang on, you can do that too. And often, Ben, I find that you're given a little bit of responsibility. When you do well with that, you're given a little broader scope and a little broader scope. So I've really run into very few, if any, like I said, adversarial or negative interactions. It's really all about communicating, respecting your role, and respecting what they can do as well, right? And then with athletes, more and more people are being exposed to chiropractic. So very rarely now do I have an athlete that comes in that doesn't know what chiropractors do. Maybe we can take TikTok and Instagram for some of that, some good and some bad, right? But they at least kind of know what we do. And so then it's just educating them around the quality of service we provide and showing them that it's reputable, the approach that we have and the things that we can do for those athletes. So I think that part of it is getting better and better. I think we're hopefully mostly past the days where somebody's like this, the gatekeeper saying, we're not going to let you crazy chiropractors in here. I've really not run into that. In fact, I've run into respect and curiosity. And if you provide the same with them, okay, well, I do this. Well, tell me what your background is, or how do you want to manage this athlete? Or if we have an athlete that comes in with this, what would you like me to do? And what would you like to do? I think that's a better attitude than, well, I'm the chiropractor and I handle all spine. You know what I mean? That's going to get you into a lot of trouble rather than, hey, I'm here to serve. What role do I fit into best? Where do you see me advantaging this team? And then as the trust builds, you can show them more about what you can do for them. I think that's one of maybe my nugget secrets that you can take away is it's all about how you educate, communicate, and approach, whether it's the athlete, the parent, the coach, or someone else in that athlete's circle.
Love it. Love it. Appreciate that. As we go towards the end of this conversation, I would love for you said you're a man who loves to plan. If you could kind of just touch on, you don't have to give us too much details of the things that are, top secret, but just your vision for the next 5-10 years, the direction that Fix is moving in, the direction that what is the potential that we have as a profession, as a sub-community of the profession, as a student culture, as a student? What can we expect as far as the progress and the evolution of sports chiropractic?
Well, I really think we can reasonably expect further integration and appreciation of what we offer to athletes and to teams. So I think the opportunities are going to grow as long as, again, we responsibly manage that. If we go outside of our lane, if we move too fast, if we operate in a mode that that we're unqualified for, then opportunities can dry up, can shrivel, and people can get resistant, right? But having said that, I think that specially certified sports chiros who put a lot of work into this, are dedicated to opening this up. So I really think that more and more opportunities will be available, which means we need more and more good qualified sports chiros. So I don't want to say totally the sky's the limit, but it's really opening up. And another thing is, I think we've shown our value on a volunteer basis, and that now it's time to start making that ask to be remunerated for our work. So more sports chiros are going to be paid and be paid well to be part of teams. And that's already happening. You see every NFL team, I think it's just about every NBA team, if not everyone. Dr. Forrest Allen is with me. Does every professional baseball team have one now? Yeah, every professional baseball team has one. And I would guess that they're getting paid. Not many of them are probably volunteering on a professional basis. But I think that's important too. Not that in the money itself, but in the recognition that the professional quality of what we offer is recognized and is remunerated for. So I think there's opportunities there. And then this is blowing up worldwide. It used to be chiropractic was just in the U.S., and sports chiropractic was kind of a specialty just in the U.S. That's kind of where it was first certified. And I'm proud to have been part of that and to know some of the people that founded that. And like I said, we stand on the shoulders of giants, right? You mentioned that. But now, I'm going to be teaching in Paris in June. I'm scheduled to teach in Chile. I taught I went to an event and worked one in Turkey last year and taught in Switzerland the year before. How crazy is that? Like, I can't even believe I'm saying that because, like I said, I'm just a small town guy from Bozeman, Montana. So I think that the international opportunities to be part of that, if you're from another country or travel to those and serve as American sports chiropractor, are really, really neat. So, yeah, it's hard to say exactly where it's going to go, but I see it on an upward trajectory. And if you take the time to be skilled, those skills will be recognized and utilized.
Amazing. And then just the last comment, I'm curious, pre-chiropractics never really been, never really been shown a lot of energy and effort and love to expand and grow it. What's your thought about this whole idea of focusing on that population of people before they get to chiropractic school? Maybe they have more time in their schedule. Maybe they have the ability to have a fresh set, like sort of blank canvas, that we could really organize the different pathways. What do you think about pre-chiropractic?
Listen. I think it's amazing. And listen, some of the best chiropractors, including some that are in this room right now and that I work with, um, had some vision before or exposed to themselves before they got into chiropractic school. Maybe they were a high school student or maybe just in university and had heard about chiropractic, so exposed themselves and wanted to ask a bunch of questions. I think it's brilliant. I think the more you know ahead of time about the pathway, the more efficient you can be. And I always say, if I'm doing a good job as a mentor or as a business owner or as a to a protege, they're achieving this success faster than I did because we take the roadblocks out of the way. We define the path a little better. And yes, there may be a new path that you can forge and break down, and you might find a way faster than me, and that's what I want. So I think this idea of pre Cairo, planning, training, foresight, I think it's brilliant. You're doing good work.
Thank you so much for the time you spent today. It's invaluable for any students to have the privilege and will have the opportunity to tap in with these messages that you've shared. And yeah, we're building a better profession together. We're building a better pathway. I think that the more students we could put this in front of, that the student culture will rise as a result of just more clarity and more conviction. And this is what I want because I'm listening to this message and it resonates. So thank you so much.
Yeah, you bet. And I'll leave you with this and the students with this. Look, things can get tough. It can get busy. You can hear all sorts of things about insurance companies and be overwhelmed with board reviews and trainings. You're getting into a wonderful profession. And if you want to specialize in sports, there's tremendous opportunity out there. And look, I wasn't the smartest guy. I wasn't the top in my class. And even these opportunities presented themselves to me. So with hard work and dedication, the sky is the limit, and you're getting into a wonderful profession that really helps people. So keep on going. And if I can be of help, reach out to me personally, contact me through Fix or through social media, or we'll, hopefully share my information on here. I'm happy to try to personally help someone that has the moxie to ask.